I see myself as a little bit of a disruptor. And I could see, you probably think that too, but how you got into genetics, the DNA company, is a story a little bit personal, right? Because you struggle with some health conditions and that led you to it. Could you share that story of how you came to where you are now?
Yeah, so I came from a completely different industry. I used to sell expensive trinkets to Canada's richest people. That was my business. We had the records for the most valuable painting ever sold, most valuable antique Patek Philippe watch. That's what I used to do.
Nice.
And it was in that my skill, what I really enjoyed doing was sort of the PR and marketing, like getting out there and talking to people, right? So I started doing that for other companies, and I literally built the PR firm from scratch, being entrepreneurial. Like I just can't not do it, so I had to do it, right? And we quickly became Toronto's top firm. You know, we went from Canada's biggest companies to literal mom and pop shops. We did quite well very quickly because I thought like the entrepreneur. I didn't think like the PR graduate from school, right? So I understood what they need, gave it to them. And it was in that journey that I got to my mid-30s. I'm 42 now. And I got sick, like really sick. My business partner used to have to drive me home because I would be vomiting from migraines, eczema, psoriasis. I couldn't get out of bed in the morning. All the typical stuff where you go from like doctor to Dr. Google to finally to a functional doctor who might kind of figure something out, right? The root cause stuff. And it was in that I learned in Toronto, the greatest genomicist I believe that's alive today happened to be a 10-minute drive for me. And we started diving deep into my genetics, and I figured out what all these environment, nutrition, and lifestyle loads were that my genetics weren't designed for. And I wasn't actually sick. I just had crossed the threshold where my body could now cope with all that load I was taking. And that's why nobody could fix it, right? A few months later, it's all gone. And I have not been sick since. I don't even catch a cold anymore. Forget about eczema and all that stuff. So it was through my personal struggle that I got here.
Yeah, I find so many entrepreneurs do that. They struggle with something. And a lot of times it is their health, because a lot of times you're just driven, right? And that drive means sometimes sleepless nights, not eating as well, not taking care of yourself, not exercising, right? You're just jumping from one meeting to the other. And then your body says enough is enough, right? And depending on your genetics and predisposition, it'll give you something to deal with.
And you ask the typical entrepreneur who hasn't hit the wall yet, right? They don't think sleep is a good idea. It's like, well, I'm not weak. I'm not going to sleep extra. I need to sleep 2 hours. So that's what proves my strength, right? They haven't got there, and eventually everybody does. And that's when you start to self-actualize and learn what it takes to maintain what you got, right? And that's kind of what happened to me.
It's a crazy societal norm, especially for like entrepreneurs and hard workers. It's like sleep when you're dead. It's like, yeah you'll be dead really soon, actually, if you keep that up, right? You got to change that mentality. And I know so many Arianna Huffington and others are now changing that. And we're seeing that is also something that can trigger genes to go in one way or the other. So there's so many genetic testing companies out there. It seems like a new one comes up every week. That's for your fitness, for this, for your, microbiome, all of this. What sets the DNA company apart?
So testing, the reason why you're seeing so many testing companies is because the testing side of it has become very easy. Meaning I can literally call Illumina. I'll tell you the name of the manufacturer. Anybody can go buy the machine. It comes with the reports built in, right? Because everybody already knows this gene means this gene means this gene means this. And so that pushed everyone into the direction of what we call genetics, meaning what does each gene tell you? The trick is that's not the way the body works. You don't have a bunch of independent genes doing a bunch of independent things. That's like saying music is like 20 separate instruments in separate rooms. It's a symphony. You got to put them together to hear the song, right? So the same thing applies to genetics, what we call functional genomics, meaning how does the body work? Let's start there. What does the cardiovascular system do? Where does it fail? What's that first glimmer of the disease? And then what genes instruct getting you there, right? And it may not be the disease itself. It may be, again, an environment, nutrition, or lifestyle load, which is typically what it is, on suboptimal genetics that leads to the disease. So that's what we did. We said genetics has done a really good job of solving a really small problem, genetic conditions. I'm born with sickle cell syndrome, some rare form of autism, etc. They do a good job there, and they're going to find those switches to turn on and off with therapeutics and problem solve. 90% of our healthcare budget is chronic disease, which for the most part we're not born with. And so when you go to these genetic testing companies, you're talking about their websites, they literally will say, We deal with this rare form of cardiovascular disease, but for the most part, cardiovascular is a lifestyle problem, right? So what they're saying is we don't deal with that. What we did is, okay, here's the suboptimal genetics, points to 80% chance of Alzheimer's. Why did 20% not get Alzheimer's, but the same suboptimal genetics? What did they do? Because if you're telling me it's not 100%, it's not like sickle cell syndrome again, but it's high probability. Why? Because system-wise, there's something failing. There's some suboptimality, something's not wired right, but you need the load to trigger that response to make you sick. And this is what we worked on. We literally studied 6,000 people, one by one, to understand in all these suboptimal buckets, why did some people get sick and why did some people not get sick? What were the choices they made? And then we understood how to tell people what to do.
Isn't there an infinite number of choices, though? Like, if I'm going to play devil's advocate, I'm going to say, and being in medicine, I know this because the days of generalized protocols are completely gone. And understanding that one person went down one road and used exactly this type of treatment, it won't work on the next person either. And then you have however many billion there are people on earth having their own, personalized plan that, of course, I can understand. You could peek in under the hood to see what the genetics are showing. But then the choices, every single little one, how do you address that?
That was our biggest fear, was in our early days, we were highly clinical and high touch, meaning that we never believed that we were going to scale this out to everybody. We thought that we're going to reach more people by charging more money. How else can because we have to train people to think like us, which is very difficult, et cetera, right? So that's what we work with professional athletes, celebrities, executives, because that's who could afford to pay for that expensive, high-touch scientific experience. What we started to see, which we didn't anticipate, was that there was trends in these suboptimal profiles.